We take a break, more to come. And we go to the business report with Joel Crossgill ahead of that break.
Lots to share with you in the business report today, relating to the wealth of Caribbean nations and the health of their citizens, recently explored by experts from the World Bank and regional health organizations, as the growing challenge of non-communicable diseases (NCDs) were submitted for examination. The unique challenges of tackling NCDs in island nations was brought into stark relief by Lilia Barunchuk, the World Bank's country director for the Caribbean.
I don't know if you know, but over 75% of deaths in the Caribbean are attributed to non-communicable diseases like cardiovascular diseases, cancer, hypertension, and diabetes, mirroring the actually global trend where these diseases dominate the public health landscape. However, the news is not all bad. The data shows that targeted actions can result in significant cost savings and improved health outcomes, offering a pathway to both healthier populations and stronger economies.
Devastating economic consequences, including productivity decline and unsustainable healthcare costs, have led to losses equivalent to 5.87% of GDP, with Jamaica suffering $17.2 billion in lost economic output over 15 years, according to data referenced by Dr. Edith Valenye, World Bank senior economist.
Now, there has been lots of very exciting economic analysis, diagnostics done to understand really the impact of not only on health, but as it was said, on the economic impact of NCDs. And quantified, it really means that about 75 million annually is lost in NCD-related productivity in Barbados. While in Jamaica, another study which was looking at a 15-year horizon, it was identifying a 17 billion economic output over this time period. So this is the huge impact.
Without targeted interventions, the World Bank's analysis suggests the region faces rising premature deaths or deaths before the age of 70 and escalating healthcare expenditures.
Addressing non-communicable diseases requires more than healthcare reform. It actually demands a very important societal shift. And by adopting actionable strategies and leveraging insights from across the region, we can tackle root causes and create sustainable solutions to address this issue. NCDs is not just a health challenge, it's an economic imperative. And the future of health in the Caribbean must be one where we act decisively to address non-communicable diseases and to protect our economies, and of course, to protect people's lives in the Caribbean. Together, I think we must invest in prevention, strengthen healthcare systems, and create policies that ensure healthier, more productive lives for all Caribbean citizens.
According to Dr. Shayna Sire-Filbert, Senior Medical Officer in the Ministry of Health, Wellness and Elderly Affairs in St. Lucia, that ambition will require massive buy-in across sectors.
We have not come to a point where we see health as a right. And so we don't treat it as a right. Many times when we think about the right to health, we're thinking the right to healthcare, and in a lot of cases, the right to secondary healthcare, which in itself is a problem. It has to be health in all policies. There has to be an all-of-society approach to actually target NCDs. So I think for a lot of our Caribbean countries, health, in a sense, is almost on the Ministry of Health's shoulders, and it should not be. Health needs to be the business of all, and so that the sectors need to be able to speak to each other. We need to have commissions with multiple sectors.
However, the World Bank suggests the roadmap to recovering the health profile of the region is well known.
In the case of investing in prevention, we've seen it in various studies, but very specifically in Jamaica, which has done an excellent investment case. We have seen that for every $1 spent on NCD prevention, $2.1 has been the return. So it's a no-brainer that obviously we need to invest in prevention. So we have the recipes, we actually have the interventions, you see them right on the screen, and it's again, no-brainers, all of them, tobacco taxation, alcohol taxation, advertising bans, road safety, and so forth, and creating environments where you want to do exercises. So we have these interventions right at our fingertips. But the challenge is that they're not always implemented to the extent we wish them to be.
And that was your business report. I'm Joel Crosskill.